Hello students. So we are going to start our part 2 of the introduction to hospital, as we have already discussed some of the topics of the introduction to hospital. The topics which we have covered earlier in part 1 is the definition of hospital, functions of the hospitals, various classifications based on the different criteria. Up to this we have covered in our part 1. The remaining topics left are organization and the management and health delivery system in India, which we are going to cover in this part 2. So, what is the organization? What do you mean by the organization? Basically, it is defined as a dynamic process in which various managerial activities bring and bind people together for the achievement of common goals and objectives. Various managerial activities included all the staff of the hospital, including the main owner, including the directors, including the medicine people, including the dentists, including the physicians, including the nurses. So they all bring and bind. The managerial activities bring and bind these people together and then achieve the common goals. What are the common goals? The common goals are the same as the functions of the hospital. The primary goal of the hospital is to provide the patient or to diagnose, cure, treat the patients, right? So to achieve that functions, the managerial activities bring and bind that people, okay? So what is the typical hospital organization? Okay, typical hospital organization is all work together only possible by a team approach. Whenever these people team and work together, then a successful hospital organization is possible. So basically, a successful hospital is based on good community-oriented planning, good design and construction, and good administration. The most important body of a hospital responsible for the proper functioning is the administrative staff. Okay, the most important body of a hospital is the governing body or the board of directors or the board of trustees. Okay, they consist of eminent personalities in different fields of medical education, administration, research, politics. The function of the governing body is to frame all major policies, plans, and programs of the hospital. They appoint an administrative staff. Okay, they appoint a hospital administrator to get the various functions performed, like clinical services, nursing, pharmacy services, etc. So the administrative staff main function is to enforce the trust policy in the daily routine. Further are the medical staffs. Medical staffs, every hospital have a medical staff, obviously, which provides the medical care to the patients as per the ethical conduct and the professional practices of their membership. So in this, the medical staff can be further divided into 4 parts, like residential medical staff are there. Residential medical staffs are available on 24-hour service basis and is available round the clock to attend the patients. Okay, so they are always available there. Second are the associate medical staff. They are the practitioners. They are the practitioners that appointed and assigned to the various services in the same manner as members of the active medical staff, but they are advanced to the residential medical staff. Third are the consulting medical staffs. Consulting medical staffs consist of medical practitioners of recognized professional ability and is not the members of other preceding categories of the medical staff. Okay, if the residential medical staff or associate medical staff need any advice, they just go to the consulting medical staff and take their advices and then treat the patient. Fourth one is the honorary medical staff, sorry. It's like part-time consulting medical staff, okay? The personnel of this group may be retired, or the eminent physicians or the practitioners who have their own clinic but provide honorary services to the hospital. They may have their own clinic or not, but they provide the honorary services to the hospitals. So these medical staffs can be further subdivided according to their medicine division, surgery division, and according to their specialization. Next hospital organization part is the supportive paramedical services and the staff. Okay, in the supportive paramedical services and staff, various services comes like pharmacy services are there, medical record services are there, radiological services sometimes come under this. Okay, so we will discuss this further in detail. So all this type of services come under the paramedical services. Next are the nursing services. As we all know, okay, nurses are the important part of the hospital. They personally take care of the patient. They take care of the patient on 24-hour basis, right? Then the dietary services. Dietary services are also the very important part. If the patient is especially on special diet, like if it's a kidney failure patient is there, and it is then there is a need to give them a salt-free diet. Okay, so dietary services take care of that. Dietary services take care of the patient according to their disease and give them that diet. Then the central sterile services, okay, they take care of the equipments needed in the operation or some other way. Okay, they take care of the equipments because sterility is very important in the hospital. They sterile the equipments well and distribute them to their wherever there is needed. Okay, in a hospital, in an operation theater, or in other uh, like in labor room. So they just distributed them by sterile. Then the radiological services. Radiological services are like X-ray services. Okay, if there is a patient who accidental patient, right? The patient is injured and there's a need to check their, so X-ray is needed. Okay, if pregnant woman is there, so to check them there's a needed ultrasound or or sonography. So these services should be in the hospital, so that patient should not be in a rush to go somewhere to check themselves, right? So radiological services is also a part of the hospital organization. Then the dental services. Okay, oral hygiene is also very important. So dental services is also a part of hospital organization. We will discuss this in further detail. Other or important part of the hospital organization is the outpatient department. Outpatient department is also known as the OPD department. Their main focus on the comfort for outpatients, as in case of major minor illnesses. Their function is to make a hospital an ideal community institution. Okay, they basically their work is to consultation with doctor. Okay, if the patient come and there's a need to consult the doctor, they come in outpatient department, OPD. Okay, in OPD, there are various functions done, like undergo the investigations, minor procedures are done. Okay, health education is provided, specialty services are also received in OPD, and rehabilitation services. Rehabilitation services we have covered in part 1, included the speech language therapy or the physiotherapy. So these type of services are provided in the OPD department. Okay, basically the patient do not stay in the hospital there. They just come and consult the doctor, and according to their diagnosis, they take the treatment, right? Next type of department is the emergency and the casualty department, which is a part of organization of department. Okay, in this, basically the victims of accidents come. Okay, the patients with cardiac arrest or the patients with breathing difficulty, they need emergency treatment. They came to the emergency or casualty department, or a pregnant woman who is in labor. Okay, they come in the emergency casualty department. Then the inpatient services. Okay, this is also an important part of organization. In this, a continuous care is required, a continuous attention is required of the patient. Okay, in this case, the patient stay in the hospital. In OPD, patient do not stay in the hospital, but in inpatient services, they stay for overnight or for several days or weeks or months for diagnosis, treatment, and therapy. In this, the patients have given the facilities for lodging, medical, and nursing care. Other services are the dietary department, pharmacy department, other paramedical services, which we are going to discuss further. Next is the nursing department, very important part, as I've already told you. This department is work under the head, the nursing officer or the nursing superintendent. Further people come under them are assistant nursing superintendent, nursing supervisors, head nurses, staff nurses. So all these nurses should possess the proper license or the registration to practice as a nurse in the hospital. Okay, they functions all the 24 hours. Okay, the assigned nurses are generally assigned specific number of beds. Okay, have given personal attention to the patient as shown in this figure, and they are trained for the prenatal care, observation, patient comfort during labor, etc. They take care of all these things. Second, which is also a part of nursing department, is the nursing education services. In this case, educational institutes are attached with the hospital. Educational institutes were giving the education on A&M, GNM, BSc nursing, post-basic BSc nursing, MSc nursing students. Okay, so they are attached to the hospital. So the main nurses give them the theoretical, even the practical knowledge. Then is the paramedical services, paramedical department. Okay, the main function of paramedical department is to have the laboratory. The main function is to perform the various investigations regarding the urine test or the stool test or the blood test. So the laboratory come under the paramedical department. Okay, they perform the various investigations. Other than that, different sessions are also included like hematology, biochemistry, bacteriology, parasitology, pathology, blood bank. Okay, so all these things are come under the paramedical department. Okay, so both laboratory and the different sessions are important part of the hospital, because in operation theater, whenever there is needed, a blood bank is required. Okay, or urine test is required, or blood test is required. So they all are present in the hospital. Then there's the radiological services. Okay, radiological services are generally performed under the direction of a competent radiologist, chief radiologist assisted by the various technicians. Services including utilization of equipments like sonography, as I have already told you, ultrasound, X-ray, CT scan, etc. So basically, this department should have safety precautions to prevent the radiation exposure to the patient and even to the staff of the hospital. So they take care of that. Then the dietary services. Okay, they provide the nutritious diet for the specific disease conditions. Okay, so they meet the dietary requirements of the patient, like special diets are given: salt restricted diet, fat restricted diet, diabetic diet. According to the disease of the patient, they give them the diet. Okay, so they are the more responsible person. Then the pharmacy. Pharmacy is the very important part because they provide the medicines required by the patient, especially the inpatients. Inpatient services we have discussed, they require the medicines, and that medicine will be provided by the pharmacy. So they're responsible for the storing and even the dispensing of the medicines and the IV fluids. Along with this, they fill the prescription and number of necessities from the wards. Their functions are drug procurement, drug procurement to distribution to IP and OP. They are responsible for proper drug delivery, manufacturing information system, sterilization, drug storage, and advising the patient on the drug use. Other departments are housekeeping department. They take care of the patient needs, and maintenance department. They maintain the hospital requirements. Central sterile services department. Their function is to provide sterile item, linen, or equipment to the wards and operation theater. Laundry department. They provide the clothes required by the patient or the doctors or other staff. So these are some other departments which should be in the hospital. So this is the part of the organization of the hospital. Our next topic is the management of the hospital. How should the hospital managed? So basically, what is management? Management is a process of planning, organizing, staffing, and controlling any organization. Okay, so basically management is called as a process. It has different meanings. It is called as a process which plan, which organize, which staff, and control the organization. Okay. Hospital management is also taken as a subject. Hospital management is also taken as a pupil. The people who are working there to manage the hospital properly, like dietitians, physicians, nurses. Hospital management is also taken as a career. Okay, so there should be different meanings, but we are going to discuss mainly the management as a process. So what are the objectives of the management? The main objective is to provide the adequate stock of items, but at the same time, it should not be too much in quantity, because if there is too much in quantity, the chances of deterioration is also very much. Okay, so the wastage should be avoided. It should be stored in a manner that an item can be easily traceable or obtainable and distributed easily according to their usage in emergency department, in casualty department, or in other departments. Second objective is to ensure that the resources available are used most effectively, and drugs for stores should be purchased at the most economical prices. Okay, so the drugs should be available in economical prices and stored in an effective way. So these are the objectives of the management of the hospital. So how this management is possible? Okay, so following procedure can be used. First of all, we need to know about the estimate the quantity and quality of each item. Okay, for that a stock register should be there. Okay, which tell us about the estimate the quality of each item. Okay, after knowing the quantity and quality of each item, the second work is to procure that item, to obtain that item of good quality, okay, from the various sources at cheap prices. After obtaining that item, the third function is to receive according to the quantity and quality specified and payment made regularly. Okay. When the payment is done, the next function is to store them properly, so deterioration is not possible, damage is not possible. They should prevent deterioration during the storage. After that, the next function is to develop a good control on the inventory. The last function is to develop a proper distribution system of drug. So whenever the drug is needed in any part of the hospital, it can be easily delivered. So this is the procedure to achieve the objectives of the management. So what are the functions of the hospital management? The hospital is basically an integral part of social and medical organization which provide the population complete health care. Okay, that is the primary function of the hospital. So the function of hospital management is to provide the complete healthcare, both curative and preventive, and whose outpatient services reach out to the family and its home environment. Along with this, it is the center for the training of health worker and for biosocial research. Second function is it's basically a process of designing and maintaining an environment in which individuals working together in groups efficiently accomplish selected aims. Okay, so basically it's a process, as I have already told. Third, management functions remain the same in all type of the organizations, whether production industry or the service industry like the hospital. Okay. The last topic is the health delivery system in India. So the health delivery system in India have the following objectives. What are the objectives of health delivery system? To improve the health status of population. Okay, it's a very important function. It's a very important objective or goal of the health delivery system in India, to improve the health status of population in rural and urban areas, to improve the experience of care. Third objective is to reduce the economic burden of illness as possible. And the fourth one is to improve the social justice equity. There should be an equity in all the patients. So healthcare delivery system in India implies the organization, delivery, staffing, regulation, and quality control of healthcare services. The healthcare delivery system in India work under the central ministry. Okay, the central ministry formulates the overall health policy and plans the new health schemes. The central government health personnel flowcharts are given under, as you have seen in this figure. The Union Ministry of Health and Family Welfare is further divided into two parts: Minister of State for Health and Deputy Minister of Health and Family Welfare. And all these people are working under them as shown in this flowchart. Second healthcare delivery system is at the state government level, which is work under the Health Minister, Minister of Health. Okay, Deputy Minister work under the Health Minister, then the Health Secretariat work under the Deputy Minister, and by this flowchart goes. And we have already discussed all the medical education, nursing, family welfare, nutrition, school education, health education, primary health center. They all work under the Health Minister of the state level. So basically, this is the healthcare system in India. So by this, we have covered our part 2, that is the organization of hospital and the management of the hospital and health delivery system in India. I hope you understand this properly, and thank you so much.